Doctors rarely mention this, but a simple glass of warm brown clove water before bed may help you feel calmer, support digestion, and make it easier to drift into deeper sleep. It's not a pill. It's not a trendy supplement. It's a spice that's been sitting quietly in many American kitchens for decades. Cloves. Picture this. It's late evening. The lights are lower. Your body is tired, but your mind is still on. Dinner sits heavy. Your joints feel stiff, or you're wired but tired, awake at 2 in the morning with thoughts that won't shut off. For many people over 60, sleep isn't just about being sleepy. It's about comfort, a stomach that settles, a throat that feels less dry, a nervous system that finally turns the volume down. Clove water isn't a miracle. Think of it as a gentle, caffeine-free bedtime routine you can test, safely and without overdoing it. Quick safety note up front. Clove water is not a cure and won't replace your medications. If you have diabetes, take blood thinners, have stomach conditions, liver disease, or you're preparing for surgery, you must be cautious. Also be cautious if you use supplements that may thin the blood, such as high-dose fish oil, omega-3, ginkgo biloba, garlic pills, or vitamin E. We'll keep the rules simple. Why bedtime can matter. Night is when your body naturally shifts into rest and repair. Digestion slows, your brain tries to move into deeper sleep cycles, and your nervous system looks for signals that the day is done. A warm drink can become that signal. If clove water helps your stomach feel calmer and your mind feel quieter, sleep often follows. Let's start. Number 1, supports digestion after dinner. If you often feel bloated, gassy, or too full at night, mild clove water may help you feel more comfortable. Why it may help? Cloves contain aromatic compounds, including eugenol, that may support normal digestive function. Traditional cultures have used cloves after meals for generations. Best timing, 30 to 60 minutes before bed. If you eat late, give your stomach a little time first. Senior-friendly tip. Keep dinner a bit lighter. More protein and vegetables, fewer heavy fried foods, and your sleep often improves too. Number 2, may discourage unwanted gut microbes, a gentle support. Clove extracts show antimicrobial activity in lab studies. That does not mean clove water kills infections inside your body, but a mild, warm spice drink may support a gut environment that feels calmer for some people, especially if your nighttime discomfort is gas, mild nausea, or that heavy after-dinner feeling. Number 3, may ease a heavy or burning feeling if you keep it mild. Some people notice clove water helps settle the stomach, but if you make it too strong, it can do the opposite. If you're prone to reflux, start with fewer cloves and drink it earlier in the evening. Stay upright for a few minutes after drinking. If reflux worsens, stop. Number 4, may support a calmer inflammation background. After 60, low-grade inflammation can show up as stiff joints and achy mornings. Cloves contain plant compounds studied for their influence on inflammation pathways. This does not treat arthritis, but when evenings are calmer and sleep improves, many people feel less discomfort and wake up less puffy. Number 5, antioxidant support during nighttime repair. Cloves are naturally rich in antioxidants. Antioxidants help your body handle oxidative stress, one factor linked to aging and many chronic conditions. This isn't anti-aging magic. It's simply a small way to add plant compounds that support the body's normal defenses, especially during the nighttime repair window. Number 6, gentle liver support, not a detox. Your liver already detoxifies every day. Some early research suggests clove compounds may support the liver's antioxidant defenses. Crucial safety note, eugenol can be irritating or harmful in excess. Don't make clove water very strong, and don't treat it as something you drink in large amounts every day for months. If you have liver disease, check with your clinician first. If liver health is your goal, the big wins are still less alcohol, fewer sugary drinks, more fiber, and steady movement. Number 7. Blood sugar balance. Important caution. Some research suggests clove compounds may support insulin sensitivity and steadier glucose responses, especially after a higher carb dinner. Important caution. If you take insulin or glucose-lowering medications, clove water could add to the effect and make glucose drop too low. If you have diabetes, ask your clinician before making it a nightly habit and monitor your numbers. If you feel dizzy, shaky, or unusually sweaty, stop and check your glucose right away. Number 8. Throat comfort in dry air. Cloves have a long history of use for throat comfort. Their aroma can feel soothing, especially in dry winter air or when you wake up with a scratchy throat. If your nighttime cough is from dryness or irritation, a warm drink may help you feel more comfortable. But it's not a replacement for asthma, COPD, reflux treatment, or prescribed inhalers. Number 9. Mouth and gum comfort, best as a gentle rinse. For the most direct oral benefit, let the clove water cool. Swish gently for about 20 seconds, then spit. This may freshen breath and support gum comfort. Keep it mild. If it stings, it's too strong. Number 10. Calms the heart through relaxation, not emergencies. When people say a drink calms my heart, they usually mean it reduces stress sensations, racing thoughts, chest tightness from anxiety, or that wired but tired feeling. A warm, caffeine-free routine can help lower nighttime stress. Better sleep supports healthier blood pressure and mood over time. Important, if you have chest pain, severe shortness of breath, fainting, or new alarming symptoms, don't self-treat. Get medical care. Number 11. Sleep support. The practical reason most people try it. Many people try clove water for the same reason they try chamomile. It's warm, caffeine-free, and helps them unwind. 2 common reasons seniors wake up at night are stomach discomfort and stress-light sleep. A gentle bedtime drink can help with both by settling the stomach and signaling the nervous system to slow down. Bathroom trips tip. Don't drink a full cup right at bedtime. Try it 45 to 60 minutes before sleep and keep it to a moderate amount. Number 12. Immune support, without over-promising. Clove extracts show antimicrobial activity in lab studies, but that does not mean clove water cures infections. What it can support are the basics that keep your immune system strong: hydration, lower stress, and deeper sleep. Those basics matter more than any single drink. Number 13. Skin and looking rested, usually indirect. When sleep improves and late-night snacking drops, many people look less puffy in the morning. Cloves contain antioxidant compounds, but the most noticeable skin benefit is usually indirect. Better rest, calmer digestion, and fewer stress signals. Number 14. A simple replacement for late-night snacking, sometimes. Some people snack at night because they're anxious, bored, or their stomach feels unsettled. A warm drink can replace the habit of reaching for cookies or chips. If late-night eating affects your sleep or blood sugar, unsweetened clove water may be a gentler alternative. How to prepare clove water? Simple, mild version. You only need 2 cups of water, about 16 ounces, 4 to 5 whole cloves. Start with 3 if you're sensitive. Steps: bring the water to a boil. Add cloves, reduce heat, and simmer for 3 to 5 minutes. Do not overboil. Cover and steep for 5 to 10 minutes. Covering helps keep the aromatic vapors in the water. Strain. Drink warm or room temperature, not hot. Taste tips. Too strong? Use fewer cloves, simmer less, or dilute with a splash of warm water. Want it smoother? Add a slice of ginger or a cinnamon stick once in a while. If you add honey, keep it to 1 teaspoon and skip it if you need strict sugar control. How much should you drink? Start: half a cup to 1 cup, 30 to 60 minutes before bed. Max: 2 cups per day total. Why start small? Cloves are potent. Too much can irritate the stomach, lower blood sugar, or interact with certain medications. Medication timing, simple rule. If you take nighttime medications, keep clove water at least 1 to 2 hours away from your meds unless your clinician says otherwise. Batch prep, optional. If it helps you stay consistent, you can make a small batch and store it in the fridge for up to 2 days. Reheat gently, don't boil it for a long time, or it can get too strong and bitter. Mistakes to avoid plus signs to stop. Keep this list simple. Avoid making it too strong, drinking it piping hot, taking it immediately after a heavy meal, adding lots of sweetener, using it to replace needed medical treatment. Stop and check with your clinician if you notice heartburn, nausea, burning stomach or diarrhea, dizziness, shakiness or unusual sweating, possible low blood sugar, easy bruising or bleeding, itching, rash, swelling or breathing trouble, possible allergy. Who should avoid clove water or be extra careful? Talk with your healthcare provider first. If you take blood thinners such as warfarin, clopidogrel or higher dose aspirin, or have a bleeding disorder, have diabetes and use glucose-lowering medications or insulin, have stomach ulcers, IBS, IBD, severe reflux, or a very sensitive stomach, have liver disease, are scheduled for surgery or a procedure with bleeding risk. Many clinicians recommend stopping concentrated clove use about 2 weeks before. Follow your doctor's guidance. Have a known clove allergy, are pregnant or breastfeeding. Large medicinal amounts are not well studied. A gentle 7-day trial, if your doctor says it's okay. Day 1 to day 2, half a cup, mild strength, 3 cloves. Day 3 to day 4, 3/4 cup to 1 cup, 3 to 4 cloves. Day 5 to day 7, 1 cup, 4 to 5 cloves. If you feel fine, track 3 things in the morning. Sleep quality, how many times you woke up. Stomach comfort, morning energy and mood. Who tends to benefit most? Clove water is most likely to feel helpful if your sleep is being disrupted by a heavy stomach after dinner, mild throat dryness or irritation at night, stress, worry, or a racing mind. If your main issue is severe pain, frequent nighttime urination, untreated sleep apnea, or medication side effects, clove water may not be the solution, but it can still be a comforting routine alongside proper care. A simple bedtime routine, 3 minutes, sip slowly, don't chug. Sit upright for 10 minutes afterward, helps reflux. Do 6 slow breaths, inhale 4 seconds, exhale 6 seconds. This is one of the easiest ways to tell your nervous system, we're safe now. What to expect, realistic timeline. Night 1 through night 3. Many people notice comfort, less heavy digestion, calmer mood, easier winding down. By 7 days, you'll know if it's worth keeping. Track wake-ups, stomach comfort, and morning energy. If nothing changes after a week, let it go. Not every habit fits every body. FAQ, only the 4 that matter most. Q, can I drink it every night? A, it's safer to cycle. Try 5 nights on, 2 nights off, or 1 week on, 1 week off. Q, I'm on a blood thinner. What should I do? A, don't guess. Ask your clinician or pharmacist before using clove water regularly. Q, I have diabetes. What should I do? A, ask your clinician first and monitor your glucose when you try it. Start mild and small. Q, I have reflux. Should I avoid it? A, not always. Try a mild version earlier in the evening and stay upright briefly. If reflux worsens, stop. Quick recap, easy to remember. Keep it mild. Stronger is not better. Best timing is about 30 to 60 minutes before bed. If you're on blood thinners, diabetes meds, or have stomach or liver issues, check with your clinician first. Stop if you feel burning stomach, low blood sugar symptoms, or any allergy signs. Avoid mixing it with alcohol as a nightcap. Avoid clove water if you have active mouth ulcers or a high fever, since some people find warming spices worsen irritation. Clove water can be a simple nighttime habit, but moderation matters. It's not a cure and shouldn't replace your medications or your doctor's advice. Now, I'd love to hear from you. Have you tried clove water at night, or are you thinking of testing it for a week and tracking how you feel? Drop a comment below. And if this helped you, please like, share it with a friend over 60, and subscribe to Eat Well Over 60 for more simple, practical health tips every week.